Welcome to the Smiles Are Wild channel, brought to you by Pediatric Dental Associates and Orthodontics. My name is Amy Morgan. We will be bringing you fun and educational videos weekly to help you take better care of your child's oral health care needs at home and on the go. Make sure to subscribe and turn on notifications to see all of our new videos. And remember, it doesn't really matter how you take care of your teeth as long as you take care of them from the beginning. Marketing coordinator here for Pediatric Dental Associates and Orthodontics. And we are live this afternoon to give you a little bit of an update on what is going on with all the precautions and everything that's going on surrounding our business with the current coronavirus issues that have been going on. Before I get started, I want to make sure that somebody can get logged on and make sure they can hear me because I don't have my usual microphone today. So I'm going to wait just a couple of minutes maybe and see if somebody can get logged on and tell me if they can hear me. Also, I announced earlier on our Facebook page that we would be going live with some educational resources. That is being postponed temporarily until we can get some more information together for that. So if you're logging on just now and you can hear me, please let me know in the comments that you can hear me. I would really appreciate that. And then I will get started with our update. Again, if you're watching this and you're just logging on, go ahead and like us on our Facebook page and follow us on Instagram. You can find both of those by searching Smiles Are Wild. This information will also be available over on our YouTube channel within the next couple of days. And you can also find it on our podcasts on Spotify or Apple Podcasts by searching Smiles Are Wild as well. I'm going to wait just a few more minutes. See if anybody can tell me if they can hear me. If not, we're going to call in reinforcements via text. Let's see. Can you hear me? I see people are watching. There's like 15 people on here. I just need to know if you can hear me. I'm calling in for reinforcements. Sorry to keep you waiting if you are logged in. It'll be just a moment. We're just trying to make sure the sound is working because I do not have my regular mic attached. So I apologize if you have to wait just a second to see if it's working. We'll just see if anybody's out there. Again, we're going to be doing lots of social media updates regarding this subject here in the next couple of days. So if you are not already following us, go ahead and like us here on Facebook. Follow us on Instagram. Both can be found at Smiles Are Wild. And you'll also want to turn on your notifications so you have the most accurate information at the time, because since this is such a fluid situation, we want to make sure that all of the updates are done in real time. And we will actually pin this most recent video that we are recording right now to the top of our page so that you can hear this. And we will go from there. So we're still just waiting on an update to see if the sound is working. I apologize that it's taking so long. Great. I have confirmation that I am being heard. So perfect. Okay. So, as you know, many businesses across the U.S. Have been coming out with their precautions, what they're doing in the office. We came out late last week just kind of saying we were going to continue to be following our OSHA guidelines along with CDC recommendations, but we would continue to be seeing patients as normal. However, we have received an update from the Arkansas State Dental Board of Examiners and the Arkansas State Dental Association, and I'm going to read that aloud now. I'm going to read it directly off the paper so that I do not mess it up. We have received the following recommendation from the Arkansas State Dental Association, and we will be adhering to their request. In light of an ongoing COVID-19 concerns and Governor Hutchinson's recent state of emergency declaration, the Arkansas Department of Health recommends voluntary suspension of all non-emergency or non-urgent dental care to all dental patients through April the 3rd, or longer depending on the severity of the pandemic in Arkansas. This recommendation is subject to change at the discretion of the governor and Secretary of Health. The only dental care to be provided at this time should be emergency or urgent in nature that specifically addresses oral pain and or oral infection management. We will not be seeing any cleanings, checkups, or non-emergency treatment appointments, but please note, if you have an appointment currently scheduled for a crown, extraction, or a hospital procedure, then we are not canceling those appointments, and you may be called to actually move that appointment up to an earlier date. We will continue to practice the most stringent of standard precautions to prevent the transmission of illnesses in our office, including screenings of all visitors. At this time, we feel this choice made the most sense to protect everyone in and around our practice. Our staff will be contacting all patients that are affected by this change to cancel their appointments as soon as possible. We will then contact you later to reschedule when we have a better idea of when we will be allowed to see these types of appointments. Please be patient with us and as we try to contact everyone in a timely manner. On a more personal note from our doctors, please stay calm and continue to practice hygienic steps such as washing your hands and covering your coughs. We are thinking of each and every one of you, and we hope that these measures will ensure that a happy and healthier future is upon us. Signed sincerely, Dr. Jerry, Dr. Will, Dr. Courtney, and Dr. Jason. So, all that being said, we are going to be kind of condensing down our schedule a little bit. So our office hours are going to be changing. We are going to be closing our Bentonville location completely and moving all appointments over to our Fayetteville office. And our office hours will now be between the hours of 8 and 1. So we will be changing some of your treatment appointments. So if you are scheduled for something that we consider an emergent situation, we will be contacting you to possibly move that appointment to a different date or a different time. And then we're also going to be rescheduling and canceling all of our cleaning appointments. So for sure, if you're scheduled for just a simple checkup in our office between tomorrow, March 18th, and Friday, April 3rd, then we will be canceling those appointments. We are going to start contacting everybody in order. So everybody with appointments for tomorrow we've already started the contact process for that. But we will continue to carry out through the schedule as quickly as we can to get to everybody. But we are going to be just canceling those appointments and not rescheduling them. Again, we're going to be screening all visitors up on the time that they arrive at our office, and that will be in our Fayetteville office. We'll be taking temperatures, asking questions, just making sure that we are providing a safe environment for everybody. The reason that we are going to continue with some of these treatment appointments and not completely close is because some of these children that have these appointments scheduled, those could end up being emergent situations. If we don't get some of these treatment appointments done, they could end up getting an infection, which could then cause them to have to be on antibiotics and possibly even cause the hospitals to become inundated with patients that aren't necessary. So we're going to continue to do the more urgent, emergent treatment in our office so that we are trying to keep some of those patients from having to end up in the emergency room with an abscess or something like that that could develop over the next 3 weeks. This situation is very fluid, it's very ongoing. These parameters could change at any moment, but we are working on over here on our part to try to figure out, what we're going to do as far as where we're going to put these appointments when we are able to reschedule them. We don't know if the April 3rd date is the definitive date, like they said in the statement, that could be prolonged. One of the things we do want you to understand is that there is a difference between emergent and non-emergent. So a simple filling, for example, you might be called to have that rescheduled because a simple small filling isn't necessarily going to end up being an emergent situation. If during this time frame you are having an emergency and your child is having pain, swelling, if they're outside playing and they've knocked out a permanent tooth, completely knocked out that tooth, we still want you to call our office. We can still see you for things like that. So pain, swelling. One of the things that's not technically an emergency is if they have a baby tooth coming in or a permanent tooth coming in behind a baby tooth or a baby tooth that's wiggly and won't come out. Now, what would change that is if they were in pain. So if in any time they're experiencing any type of pain, feel free to call us. We will triage that over the phone, and we will let you know whether or not that's an emergent situation. Now, because our office hours are changing, we will be open from 8 a.m. to 1 p.m. in our Fayetteville location only. We do have an after-hours emergency line. So if you call our main number and you hit all the options and prompts to get through to the emergency line, you'll be able to leave a message. And then again, we can triage you through that, try to figure out if that's something that we need to see you for in office, or if we need to have you come in the next day, or if we need to call in a prescription or something like that. And that's something we do on a daily basis after hours. So that emergency line will just be run a little bit longer into the daytime. We will still have staff available in our Fayetteville office to answer phones, things like that. So if you have any issues, please just feel free to call us. You can also email me directly. I will be answering my email at all times through this. So my email is amy@smilesarwild.com, and that is spelled AMY, and then it's at smiles, SMILESAREWILD.com. Again, you're going to be contacted by our office to cancel your upcoming recalls, what we call recalls, which is a cleaning or a checkup, and any non-emergency treatment. So we are going through our schedule right now. We're trying to determine which treatments need to be done and which ones are considered in that emergent and urgent category, and then the ones that do not. And so we will be contacting you to do some arrangements for that. Again, if you are scheduled for something like an extraction due to an abscess or something like that, we're still going to see you for that appointment. However, we may still be calling you to reschedule that to a different date or time. Your appointment may stay at the same date and time if you're between the hours of 8 and 1, but if you're outside of those parameters, it's possible you're going to be getting a call from our office. With that being said, we understand there'll be a lot of questions around that, and you're going to try to call us, and you're going to try to figure out if your appointment's being rescheduled or not. We welcome those phone calls. Just know that due to the stat, we're kind of closing down our staff a little bit, and it may take a little bit for us to call you back, but we will definitely, get your voicemail, get your message. You can also use our new communication tool, Clara. You can go out to our website and click the bottom right-hand corner where it says Message Us, and you can send us a message there. You can also call in, and there's an option to hit a button for you to communicate with us via Clara if that's a little bit easier for you. Again, this was a very, very hard decision for our doctors to make, to kind of scale down this schedule, especially with the kids being out of school. We know that, sometimes these appointments are a little bit more convenient when they're out of school. You don't have to pull them out of school again. But we hope you understand that in the times that we're in right now, that we are just trying to take the best precautions that we can and also try to follow state guidelines. Those guidelines have been put forth now by the American Dental Association, the American Association of Orthodontists, and the American Academy of Pediatric Dentistry, and our Arkansas State Dental Board. So we are just going with their recommendations and requests. We apologize for any inconvenience this may cause. If we are contacting you and you're trying to get back through to us, please give us a little bit, as the number of patients that we see, trying to get all that information out to parents and everything like that might take us a little bit of time. I'm going to be posting this information and the letter that's been drafted directly from the doctors on our pages here in just a little bit to kind of give you that information. And again, if you have any questions, any concerns, anything that comes up in the meantime, feel free to call our office. Just as a reminder, our office number is 479-582-0600, or you can also email me directly at amy@smilesarwild.com. I want to thank everyone for joining us today, and we hope everyone is staying safe out there, enjoying this time with your loved ones as you can. Stay socially distanced, wash your hands, cover your coughs, do what you can do, but most of all, just keep the faith that all of this is going to be okay. Thank you. Thank you so much for watching. Make sure to subscribe and go visit us on smilesarwild.com.